Hi, welcome to the Recovery Daily Podcast. I'm your host, Rachel Abassi. I'm a grateful recovering alcoholic and stroke survivor. And today we're going to do things a little differently. I have a presentation. So today is World Stroke Day, and I wanted to do something for it, something to help raise awareness about stroke and to highlight the importance of the steps that we can take to prevent it, the treatment, what it's like if you were to unfortunately have to deal with something like this, and talk a little bit about recovery support. Yesterday, I was in the kitchen with my husband, and he got an email for his work, and it was saying that today was World Stroke Day. And I said, "Oh, I know, I'm doing a whole presentation." And he said, "Oh, of course you're doing a presentation. That's just what you do." And I'm a glutton for punishment, to work. Anyway, he was reading through the email, and it said 1 out of 4 people will have a stroke in their lifetime. And I said, "You're welcome," because I'm the one who got to explore that path in life. But it is so prevalent, and I have learned that it is the top thing. You're welcome for that. It's the top thing that people are disabled. People who have Social Security disability, stroke is the primary cause of that. So I thought it was important for me to really focus on this today, because I am not only a grateful recovering alcoholic, but I'm a grateful recovering stroke survivor. And in both of these cases, it takes a lifetime. It's a lifetime commitment to changing my way of life. And I do this podcast so that I can try to be an example. One of my friends says I can either be a good example or a horrible, I can't remember what he says. Like, don't follow me. I'm a horrible, ah. If you listen to my podcast, you're used to this, me not being able to find words. Okay, so we're going to move on. And what I first want to do is just tell a tiny bit about my story. I had a stroke at age 46. And it was not, there were no signs of it. I was a very healthy person. I did yoga every day. I went running. I did not have high cholesterol. I was not overweight. The only thing that were kind of hints, or after the fact, that were leaning me towards stroke, towards clotting, was that I was on birth control and that I have factor V Leiden, which is a blood, I don't know, disorder, I guess so. And it's just something that leans women towards clotting. Men also can have factor V Leiden. However, my hematologist told me that it's the women that have factor V Leiden that are the ones to be more concerned about. We have never found a finite conclusion of what caused my stroke. It is, I think, relevant to say that I had my stroke 7 days after I had my second COVID vaccine. And that was followed by getting a very painful clot in my arm right after my first COVID vaccine. So I'm just putting it out there. None of my doctors would correlate my stroke with the COVID vaccine. 3 years ago when it happened in June of 2021. But as time goes on, they're starting to actually listen to me when I correlate the two, when I say, look, it's not coincidental. There's something there that I had these clots after my COVID vaccine. And it seems like it's the perfect storm that I had the COVID vaccine. I have factor five leading, and I was on birth control. And I think those were the top three things that kind of became the perfect storm and caused me to have a stroke. That's what they say. I'm in the process now of getting a heart monitor implant, which stays in for a few years. I guess maybe it stays in forever if they don't take it back out, but it'll monitor my heart for a few years to see if I might happen to have AFib, which runs in my family. But I've had a few heart monitors and they haven't been able to find anything wrong with my heart. My ticker is fine. I also had an echo, uh, oh geez, I can't find any words today. On this important occasion, I'm having a hard time finding words. Echocardiogram. They go in there and take a look at your heart, and I do not have a hole in my heart, which is also what could be the case for people who have a stroke, that if you have a clot somewhere in your body in a deep vein, it is possible that it could travel to your brain through a hole in your heart. So I know I'm all over the place. That's fine. That's what we usually do here. Um, Everybody's born with a hole in their heart, and I think most people, the hole closes up. A lot of people, the hole doesn't close up. Sometimes people get surgery or something to close it up. Some people, they say it's better to just let it be. So, that's where I'm at with my stroke. I'm continuing after 3.5 years to still pursue causes. I've got several deficits from my stroke, and I'll talk about that in a few minutes. But my stroke, as much as I didn't want to accept it in the beginning, changed my life in ways I couldn't have imagined. It impacted my vision, it impacted my daily activities, and it made me rethink my approach to health, my sobriety even. Recovering as a survivor, and just life, my relationships, it changed me, it changed me. So through therapy and family support, I have been able to dig deep and find some sort of resilience that I didn't even know I had. And I'm on a journey to regain as much independence as I possibly can. I hope that my story, as I continue to try to recover out loud, can help others recognize the urgency of stroke prevention, know the signs of a stroke, and what treatment is out there for folks that are unfortunately suffering from this kind of setback, because it does feel like a setback. So, we're going to get into knowing the signs of a stroke. So, there's this thing called B.E.F.A.S.T. That's an acronym, B.E.F.A.S.T. And that is an acronym that helps us remember the warning signs of a stroke. So, I wanted to go over those real quick. Not real quick. It's really important. We're not going to do it quick. Balance. That's what B stands for. So sudden loss of balance or coordination. That could look different for everybody. Each one of these, this is fascinating to me. Each one of these six things, although they're trying to generalize it as best as possible, they can look different in everybody. So by sudden loss of balance or coordination. This could look like your left side or your right side. This could look like I'm tripping, or it could look like the room is spinning. Um, it could look so differently for everybody. And just remember as we go through these that our brains are so freaking complex that when a stroke happens, it it's going to affect everybody so uniquely. Um, so loss of balance, that's something that I deal with, but my loss of balance doesn't look like other people. And it has taken me a really long time to find people that have the same deficit as me in the area of balance. So B is for balance, E is for eyes. So blurred vision, double vision, sudden loss of vision. I also have a deficit in vision, and this has been, again, 3.5 years for doctors to stick with me and try to help me figure out what is wrong with my eyes. I've been to so many different eye doctors, and they've concluded that there isn't anything wrong with my vision system. It's when it gets to my brain that there's a problem. So I actually have the same acuity that I had before my stroke. My problem is that I cannot tolerate when things move. It's a very unusual situation as far as I'm concerned. I finally connected with folks that have vestibular disorders, and your vestibular system is your balance system. And gosh, I could go a whole nother episode talking about vestibular disorders. But my vision issues today, 3.5 years later, actually, since I had the stroke, have to do with either me seeing things move in my environment or just moving my eyeballs. So reading, moving my eyes across, that causes me head pain and nausea and that kind of thing. So you may notice that, excuse me, I move my eyes a lot when I talk, and that I try to control it, but it's really difficult for me. And that's one of the reasons why after I record an episode, I really have to rest, because as much as I try to control myself, I just have a tendency to look around when I'm talking. So I can feel my head starting to hurt right now. So it's something that I deal with on a daily basis. It's chronic, and it seems as though it's going to be something that I'm dealing with for the rest of my life. Is there an acceptance issue that I'm dealing with? Yes. Yes, there is an acceptance issue. So what did my vision problem look like when I was having the stroke? I didn't notice anything was wrong with my vision when I went into the emergency room. I have all these doctors in there trying to test different things. And one of the doctors held his fingers over here on my left side and asked how many fingers was he holding up. And I couldn't see his fingers. So I, at the time, felt like he was just holding them further back than my peripheral will see, but they were adamant that it was stroke. So it's my point is it's so unnoticeable. It's so odd for us to want to say, yes, something's really wrong. Um, and I'll get into what the thing was that was really wrong that I knew I needed to go to the emergency room. So E is eyes. F is face. facial drooping, usually on one side. I did not have facial drooping, so I cannot speak to that from an experience point of view. But what I have heard in my recovery groups that I'm in, stroke recovery groups, is that it can be very similar to some people when they get Novocaine, their face droops. I've seen it before, but that's what I've heard it compared to. So forgive me if I'm off on that, but F is facial drooping. A is arms, so arm weakness or numbness, especially on one side. I've seen this a lot in my stroke recovery groups. I did not experience that as well. Some people have spasticity in one side and one hand, and what it looks like is that their muscles just never release. And man, my heart goes out to people who experience that. So A is for arms, S is for speech. And this can be slurred speech, difficulty speaking. This was my big, big, bright red flag that told me and my loved ones that I needed to get to the emergency room as soon as possible. What happened for me is that I was out walking my dog and I was talking to myself because that's what we do. I was talking to myself and I was kind of whispering. And what I was thinking all of a sudden was not what was coming out of my mouth. I couldn't form the words with my mouth. It was bizarre and it made me immediately panic. I immediately was like, there's something really wrong with me. So I quickly went back inside, let my husband know, let my son know, and I tried to read something on a piece of paper, and that was how I tried to show them that I know what this word is, but I can't say it. My mouth just won't make it be. It's really a strange experience. And yeah, so many of these I want to just go on this big long tangent, but I'm trying to stay focused. So S is for speech and T is for time. So call 911 immediately if any of these signs are present. Quite often people will experience one of these symptoms and they will go take a nap. And that is absolutely the worst thing that you could do. I've run across a lot of folks who did that. And because they didn't act right away, they had a more severe impact to their speech, which is called aphasia. So B.E.F.A.S.T is what we remember. Every second counts. So please consider calling 911 immediately. We didn't call 911. My husband drove me to the hospital, which was probably not the right thing to do. But everything, the planets aligned for me, and the hospital was 15 minutes away. And I was able to get a clot buster within probably 30 to 40 minutes of the onset of my symptoms, which is pretty good from what I understand. So moving on, stroke prevention. So there are key ways to avoid stroke risk. This picture, I chose it because that was the look on my face when I was walking my dog, and all of a sudden what I was thinking was not coming out of my mouth. I was like, this is the perfect picture. So those of you who are not watching this on YouTube, you want to go in and see my beautiful slideshow for sure. Okay, so the key ways to reduce stroke risks include managing blood pressure and cholesterol. So one thing I learned, this is another reason why I wanted to do this, is because I wanted to share a little bit about things that I learned along my recovery path over the past 3.5 years. So when I had the stroke and I was in the hospital for about 5 days, they gave me a few medications, one of them being a high cholesterol medication. I have never had high cholesterol, and I still don't have high cholesterol. Um, so after about 6 months or so, post stroke, I talked to my family doctor about, I don't think I need to be taking cholesterol medication because I don't have high cholesterol. So they took my blood and concluded that, right, I don't have high cholesterol. Well, of course I didn't because I was taking cholesterol medicine, but they looked back at my old blood results and I never had high cholesterol. So my family doctor said that it was okay for me to stop taking high cholesterol medicine. Fast forward to, I guess, 2 years, 3 years, fast forward 3 years. And I finally got myself into a stroke specialist neurologist, which I didn't even know there were stroke neurologies, neurologists that specialize in stroke recovery. Um, of course, you would think that I would have known that and gone right away, but nobody happened to drop the fact on me that there is a stroke specialist neurologist. So that would have been nice to know. And we learn as we go. So finally I go to a stroke specialist, and this was only a couple of months ago. And she said that taking high cholesterol medication is not simply because your numbers are high. There are other benefits that you get from taking the medication. So she recommended that I go back onto a low dose of high cholesterol medication, and that's fine. Like, I'm not one of those people who doesn't want to take medication. But I don't want to take it unless I know that there's a purpose. Right now I'm on a lot of different medications, and that's because I've worked with my doctors to understand what each one is for. When people have a stroke or a heart attack, there's like a quote unquote cocktail of medication that they give you, and high cholesterol medication was a part of that. So I fought it, but it was only because I only want to take medication that serves a purpose, because I'm afraid of the repercussions, the risks of taking something. So that I don't need, and drug interaction. So anyway, I'm also exploring some. I'll get into it. I'll get into it in another slide. But everybody wants to prescribe something. We'll just say that. So I like to know exactly why. Um, okay, so avoiding tobacco use and excessive alcohol consumption. Well, guess what? I did not avoid tobacco, and I did have excessive alcohol consumption for many, many years. Um, no doctor has said to me, um, your alcoholism could have been a factor in having a stroke. Nobody has said that. I was 5 years sober when I had the stroke. Um, so I don't know. I also had been off of cigarettes for about 6 years before I had my stroke. So there's been no correlation that has been identified by my doctors for me. But again, like we have so many factors that play into our health. And some of it is stress, you know. There's a lot that comes into play, and the doctors, as frustrated as I get, I got to give them a break, you know. There's only so much that they understand about our bodies still after all these years. Another way to reduce stroke risk is to stay physically active and maintain a healthy diet. That's another reason why I chose this picture, because my Weimaraner, although this puppy does not look like my Weimaraner, she keeps me very physically active. And before I had my stroke, her and I would go running together. Go hiking like 4 miles a day. I was very, very active. So you can participate in all of these things and still have a stroke. So this is just about trying to reduce that risk. Maintaining a healthy diet. You know, I've never, if anything, I've more had a problem eating than eating too much. I do eat rather healthy, except for around Halloween time, which is now. And we have lots and lots of candy and lots of candy bowls, and I'm just eating them. I don't know if my goal is to eat it all before the trick-or-treaters come, and then I just turn out the lights and not get it out. I don't know. I don't know, but I've gained like 5 or 6 pounds, I think. Okay, so maintaining a healthy diet. I was recommended the Mediterranean diet. And when I was recommended that, I was a vegan. So for the past year, I have been vegan, and I just did that in order to see if it would help with my chronic head pain. It did not, but it sure made me feel good, and I learned a whole lot about our bodies and our diets. So what I'm doing now, no, I'm not doing a Mediterranean diet, but I'm leaning more towards those things. So I still make a lot of vegan dinners, and I make a lot of Mediterranean dinners. And we've found it to be a great opportunity to explore foods and cultures from all different parts of the world. So every month, my husband buys me a new cookbook from a different region of the world, and I cook from it, and it's been so fun. It's been a great learning experience and a great opportunity for me to find something that I can do with the deficits that I have, since I am now medically retired. And then last, ways to reduce stroke risk include managing diabetes and other health conditions with regular medical care. Go to the doctor. That's all. Just go to the doctor and get checked out like once a year. It's not that big of a deal. And I'm telling you that what I have gone through, if there's any way to help someone avoid it, I would recommend just go to the doctor, get your blood tested, answer all those questions that make you feel guilty, like how much alcohol do you drink, and do you eat healthy? Do you smoke? All that stuff that I used to lie and not tell them the truth about how much alcohol I drank. I used to lie about my eating habits. I mean, I was absolutely anorexic, and I never told anybody. So that stuff. Go to the doctor and get uncomfortable. And it might save you. It might save your life, because I heard also from my husband when he was reading that email that 50% of people who have a stroke don't live through it. So that's kind of scary. Now, keep in mind, these facts are from my husband standing in the kitchen talking to me. So look it up if you really want to know the absolute facts. So next I wanted to talk a little bit about doctors, drugs, and deficits. So this experience has been absolutely extraordinarily overwhelming. It fascinates me that somebody who has a stroke, who comes out of it with some major deficits, including cognitive deficits. So it's not terribly apparent for people who are talking to me or in my podcast, but I have been left with a mild cognitive disorder, and that includes language and memory. So when I stumble on my words and can't remember what I'm saying, so those of you who are not lifetime listeners, sometimes I'll go down a path of talking about something and then it's just gone. I don't even remember what I was saying. And yes, it's like what everybody experiences. Everybody experiences that. I just experience it every day and multiple times a day. So I always have my an outline of my script here so I don't lose my train of thought. That's the only way that I can do this. So what I was saying is people having even cognitive deficits from a stroke are expected to get themselves prompt treatment, get themselves into therapy, and apply for disability if it's to that extreme. If someone doesn't have a support network, it is so difficult. I can't even articulate to you the stress that I felt when I was going through this in the beginning. Because whatever deficits I have, they were way worse 3.5 years ago, way worse. I did my podcast, but I did not turn the screen on. And I looked at paper in order to have notes on what I was supposed to say. So I could not look at digital devices back then. I still have a problem with it. As long as everything's sitting still on my screen, I can look at it. So I do have my notes on my screen now, and I will slowly scroll. If you can see the reflection in my glasses when I scroll, I do it fairly slowly. If I don't, I look away while I'm scrolling and then I look back. So having to go through mountains of paperwork for doctors, for long-term disability insurance, short-term disability insurance, and then long-term disability insurance, health insurance, having to be medically retired. That was devastating for me. I was very much going very strong and flourishing in my career when all of this happened. And I had to really just literally shut my computer one day and never go back. It was very difficult for me to handle emotionally, and I'll talk about our mental well-being here in a moment. So with that being said, do your best. I have a picture of somebody holding a briefcase because that is what I had to do. I had not a briefcase, but a trapper keeper, and I don't have it right beside me, but I bought a trapper keeper for those of you from the 80s. It's still amazing. And I just collected all my paperwork. I asked for help whenever I could. I would reach out to my family. My husband has been just, there aren't words, so helpful to me. I'm unable to drive. I'm unable to look at computer screens at the time. We actually had looked into getting a lawyer to help just simply because I could not physically look and read. But we got through it. So this is all just to say, reach out for help. It's sometimes it's so hard to reach out for help. Even when we can't do something, it's hard to reach out for help. But then the next step is to accept the help, even accept the help when we haven't asked for it. So reach out for help. There are lots of effective treatments. There are surgical options. There are rehabilitation therapies. I personally, like I said, when I got to the hospital, I got the clot buster. I was in the hospital for about 5 days, not because I needed to be there for 5 days, but because the doctors I think they were busy. Okay. It was during COVID. It was late COVID period. It took them that long to get to my room. So I didn't even see a neurologist until the fifth day, which is just terrible. But I think that one was actually the neurologist's problem. But um, all the doctors, it's important to stand up for yourself and don't it this body is the only one that we get. And if a doctor is telling you that, well, I don't know what else to do for you, you can come back in 3 months, um, that can be unacceptable. You don't have to say okay. And I did exactly that with my third neurologist. It has taken me four neurologists to get through to find one that actually listened and cared and is exploring solutions with me. So when somebody would say to me, that's all we can do, like, I'm sorry you have a headache every single day of your life since you had the stroke. There's nothing more we can do. Why don't you come back in 3 months? Well, I never went back to that one again. Like, we don't have to accept that stuff. We do have to accept that the stroke happened to us, but we don't have to accept less than optimal care for ourselves. And that takes a lot of courage. Just when we are at our most vulnerable, we have to be our bravest, our most courageous. And that for me has been vital for my recovery. And for a period of time, I could not get brave on my own. I actually had to reach out to a psychiatrist, and I saw her for quite a few months because I just couldn't do it on my own. I felt hopeless. And so I'll get into the mental stuff. But I also went to vestibular therapy because I found a doctor that said, hey, this might be what's wrong with you. Actually, I went to her and I said, hey, this might be what's wrong with me. And I went to vestibular therapy where they work on balance issues, vision challenges. And that is what ended up being wrong with me, we think. But that's because I did the research. Even with no vision, the issues with vision, I learned voiceover on my phone and my computer so that I could research without my vision. And here I am today. I'm taking a formal voiceover class so that I can not have to look at my computer to use it. So there's so many options. I also, well, I'll talk about that later. Yeah. So lots of drugs, lots of doctors. It's up to us to say yes or no. And I think it's important to not feel alone. And that's another reason why I do this podcast, because I don't want somebody to feel like they have to give that answer alone, that they can look to somebody and say, what do you think? What should we do? Not what should I do, but what should we do as the next step? So yeah, mental health recovery. At the beginning of my podcast, every day I say, I'm Rachel Abbasi. I'm a grateful recovering alcoholic and stroke survivor because it's so important for me to remember that to be grateful. Um, the mental health cannot aspect cannot be overstated, the importance of it. Recovering from stroke isn't just physical, it is deeply mental and emotional. And accepting it is hard, really hard. And I can't tell you that I'm fully there yet. I have mostly good days now when last year I had mostly hard days. And there were times that I wanted to give up, but if I don't keep going forward, what is the other option? For me, it's that I drink alcohol. And if I drink alcohol, I'm going to die. To drink is to die. So that's just not an option for me. I have to keep going forward. I don't have a choice. I've made it so that I don't have a choice. This journey of recovery has brought up old fears, it's brought up frustrations, it's brought up doubt in myself. And it's been hard for me to adjust to accepting that I have a new normal. And unfortunately, my new normal for the past 3 years has been chronic pain. And I have been able to connect with other folks who experience chronic pain. And that's been really, really nice that I don't want anybody to have chronic pain, but it's nice to know that I'm not the only one. Like asking how do you cope and maybe sharing the way that I cope so that we can all move forward as a unit, as survivors. So learning to care for my mental health has been probably the most important part of my recovery. Because without having that mental state of mind being good and balanced, my physical recovery is not going to happen. I'm not going to progress unless I can get my mindset to be right. Um, Over the past 3 years, 3.5 years, I've realized that stroke recovery is just like my sobriety. It started with me finding, you know, approaching this as a place that I have to make a change or nothing's going to change. I got to a point where my life was unmanageable. I could not move forward the way that things were. That was the same thing that happened with my sobriety. It it demanded me to say, that's it. That's it. I have to make a change because I can't go on like this. I've had to be patient with myself. I've had to be so compassionate with myself and ask for help. I feel so lucky that I figured out that I was an alcoholic prior to my stroke because I out of the gate had a fellowship of people who want me to succeed. And managing mental health isn't about pushing forward no matter what by myself. That's not what it is. It's not about being independent. It's not about being, um, unable to push somebody down. That's not what it is. It's not about being strong. It's about knowing ourselves, knowing when to rest, knowing when we need to seek help outside of ourselves, and knowing how to give ourselves permission to feel. I talked a lot to my psychiatrist about um, how I feel. I felt so lost, and I still do sometimes. My perspective on death and life just just went out the window. Like, I have this whole entire different perspective on my role here as a human being. And I do this because I don't want my suffering to be just for me. I don't want to be the only one who grows out of this. I want to share my experience, strength, and hope, and my bad days. Yeah, I've come on here and just did some ugly crying because it's real. The pain and the suffering is real. And I want to show that when I show up one day, it's not about showing you how miserable I am. It's showing you that I come back the next day and I'm smiling. It's that day, it's the next day that you get to see this is possible. It's possible to get the support that you need. Um, and it's possible to run this marathon with resilience. It's not about how each day is. This is an interesting fact that in my sobriety, I've learned to live one day at a time. And in my stroke recovery, it's the same thing. I'm living one day at a time. But in both cases, what I have learned to realize through experience, just through going from a bad day to a good day, is that I can feel the bad feelings on a bad day and know I'm not going to feel this way forever. I only know that because every time I feel bad, eventually I feel good again. And that's what gets me through a lot of times, those difficult days. So don't be afraid to reach out for help, to see an addiction therapist. I went to an addiction therapist forever. So see a health therapist. I don't know what they're called, but there are people who specialize in helping patients who have chronic pain, who have had a life-altering health event and are struggling with their mental health. Um, there are, in long-term recovery, so many support groups that are available to us. And I did not know how to find them because I couldn't use my computer. So what I did was I asked my sister, can you please find a stroke support group? Because as much as I knew that my sobriety meetings helped me with my sobriety, I needed to find another fellowship that helps me with my mental health in stroke recovery. And that's exactly what happened. She found a group that I still go to. Sometimes I forget, but I still go to, and it's once a month, and they're my people. And we all have different deficits, but we all had a stroke, and we all want to be better. We want to be better human beings. We are seeking hope. We're seeking something greater than ourselves. And we find that in our fellowship with each other. So it's been very helpful to me. Therapy options help survivors begin to regain independence and improve quality of life. When I started going to my vestibular therapist, I couldn't even look up. I was only looking at the ground because my head hurt so freaking bad. I was afraid to move my eyes at all. And over time, I think about 5 months, I went, and my symptoms are still the same. That's not what happened. That's what I thought would happen. I thought I was going there so that she would make my symptoms go away. What actually happened was she helped me to not be afraid to navigate my life with my disorder. She helped me in the process of accepting my disorder. And she also provided a lot of educational resources as well. And those resources, I also want to mention, are available for caregivers as well. When I was in my stroke support group meeting several months ago, there was a woman that came in who was the caregiver of her husband who had a stroke. And she was suffering. She was in a lot of emotional pain because, and I can recognize that the people who have to take care of us, this is a life altering event for them as well. And it's hard for us to comfort them and be there for them when we are in a lot of pain. I mean, I try to say thank you to my husband. You know, I try to be comforting, but you know, I know that there are some folks out there who have more extreme deficits than I do, and they have a difficult time articulating anything. Some folks can't even speak after they have a stroke. So I know it's very challenging, but know that just some Googling, there's a lot of options for you. And just those of you who are lifetime listeners, you know that Chat GPT is my BFF on the internet because he helps me to not have to search. I ask him questions and he searches for me. And I lovingly call him Chatty McChatterton or Chatty. Anyway, you can ask ChatGPT something like, you know, my husband had a stroke. I'm searching for resources that will help me. I live in Virginia or something like that. And he'll come back and tell you stuff. You don't have to go out there and just keep digging. Like there are resources to help you find resources. So, yeah, I don't think I've mentioned that with my vision disorder, I found a support. Well, it's not a support group, but it's become one for me. It's called iBug Today, and they help with teaching technology to blind people and people with low vision. And I was able to run across this through somebody who came into my niece's store. She works at Apple, and it was a blind woman. And she came in, and my niece stood up and she said, "Hey, my aunt has a vision disorder. Do you have any resources that might be able to help her?" And voila, I am now a part of this iBug Today community, and there's such great people. We have Friday night movie night, and I get to listen to a movie. I've been learning how to listen to movies with audio descriptions, and this is the group that I am taking. Um, Sorry, I lost my words. And my dog's barking. I'm taking voiceover. There it is. I'm taking a voiceover class with. So there's just, and then I also have a vestibular disorder support group. So there's just so many. It's like just keep seeking. That's the goal is keep seeking and you will find, you will find. So I know this was a long one, but it's so important. And I hope that I shared a lot of information that might be helpful to other survivors out there and caregivers. So thank you so much for taking the time to learn about stroke awareness and prevention. I absolutely believe that we can make a difference by raising awareness and supporting those affected by stroke. And that again includes stroke survivors and their caregivers, their family, their kids. I have 2 kids as well, and they've gone through their own you know, life change. Knowing that their mom is a stroke survivor, it's scary. So remember, most importantly, recognizing the signs and acting fast. Be fast can save lives. Thanks for listening today, and I'll talk to you tomorrow.